So if we are not able to converge the indicators to a unified value description, then it becomes very difficult to integrate quality as an institutional, not good to have, as they say, but as a must-have. If finance people are reading financial indices as measures of success, anything that takes money away from finance becomes a measure of failure, isn't it? So now that inability to integrate, bring everyone to the table, becomes a challenge that we observe.
Resources are there, even in this country as a whole. We know we have resources. The issue is how they are managed and how they are prioritized. And so making a case for quality. They say that quality is expensive, but they say try the opposite, not quality. It's definitely more expensive. We know even as individuals, if you go and get the wrong diagnosis, then you have to be re-diagnosed or a different procedure. It ends up being more expensive.
So we have this culture of reviewing the data, and we have made sure that this data it is in levels. We have weekly, monthly, and then quarterly data where we have MAC, Medical Advisory Committee, where we have external eyes who come and they tell us, we agree there, but there you would have done better. What does the consensus standard say? So as they say, sometimes we describe and relate ourselves to the prescription of the standard, but we fail to tweak it to fit our situation or our organizations. So that has really helped us. So everyone now in the institution, as long as you're HOD, you know this is a KPI, which at the beginning of every financial year, as we set the objectives, it is an objective for every HOD.
We noticed a trend of missed appointments. Of one doctor will say, and that's a quarterly meeting, so will say because we didn't get in touch with this patient, they came back and they were stage 4 cancer. They came back and their infection had spread. So negative outcomes because of a process that is not working well in terms of booking and making sure that we are having a proper follow-up of patients. So as a result of that, we now have a booking system that has some sort of follow-up, whereby someone will call you and find out why didn't you come and document it somewhere, so that we have a report and we can tell the reason why majority of our patients are not coming back to our clinic. It's because of they didn't know, or we didn't book them, or something like that. So we are now having that as a new process and as a new data source to improve our processes and better care for our patients.
I had written so many things about standardization in the health sector, but there's no time. But I think there is something that the health sector can borrow from what we have talked about here. In aviation, standardization is done across the board, from manufacturer to the cleaner. We do the same as fire people. Airports in the world are standardized. They are categorized according to how much fire equipment you have. If you don't have category 7 in your category, you will not be allowed to bring a 747. They'll tell you, please just bring the Focus, you don't have the fire coverage. So standardization that is being applied in aviation, I think it is important to be put across all sectors, and most importantly, in the healthcare sector.
As health practitioners, you have a lot to borrow from firefighters, because when you are called on duty, there is no timeline to stop that operation until the mission is complete, and that's what I do. When we call for fire extinguishment of a fire, we'll only stop when the fire is stopped.
I believe that any team that is open, like a book, and the information is well shared, is very resourceful. If you let probably the team that you're working with know that we are supposed to be about a staff number of 12, but here we are 8, and we have to execute all these tasks. How can we be able to share? And the reason we are short is not because somebody is refusing with the budget, but we have very limited resources.
You cannot do an electrical procedure alone. You always have to be minimum 2. And once everyone is on board, then now you can carry out the procedure. Anticipate the third parties that are going to be there. If you're looking at electrical conductors, you do not want to stop members of the public from carrying on their daily duties. So they are anticipated hazards. In the power sector, even the engineer who has a team of technician supervisors on the ground is also at risk. So for me, that is key. And I pray that even when we have these engagements, your next conferences, invite more people. And for me, I think I would also want an opportunity for us to invite health professionals in our forums, which we have already started doing, and other professionals, also to get to understand the sector, and also for us to exchange and get the way forward and for future of this country.
In the country, we are lucky to say that we have a very robust national office. That's the Directorate of Occupational Safety and the Health Services. It has the practices that they can be able to adopt it in any of the first world countries. So it is the idea of making a personal commitment to adopt to those changes.
Quality and safety is what staff do every single day. So the culture thing is that if you have one person who is not steeped in that culture, then things will go wrong. So our onboarding process our recruitment process is extremely rigorous. We recruit for skill, of course, which has to be there, but from the other 75% of the recruitment has nothing to do with skill. Is if you come to an interview and say, "I've never been involved in a mess up in clinical care," and somebody says, "I've been involved in 3," who do you think is the likely person who will hire? The person who has been involved in 3, because he understands that you can actually mess up, and so on and so on.
Then we satisfy patient clients' needs in a culturally appropriate manner. This is where we have not done very well. So, and this is where we, particularly the public sector, we need to address this. But I know private sector has gone way ahead on this.
Where we are is a place of incredible dedication and immense ingenuity, and often significant challenge. We are possibly in the most important decade for healthcare. Everyone is talking about healthcare, both in the region and in the continent. And if we do our work right, we may possibly end up doing our life's most important work. Governments like ours and in the region are focusing on health, and this tells us that we should tell them what we know for them to see things our way. And that is a quality way. We must ensure that these conversations leave the room. They can't just end here. They must leave the room. And we are characterized by high patient loads, constraints on technology and infrastructure, and the constant pressure to do more with less.
God knows the gift of you being here is a sign of transition, that the mantle is moving to the next people, next generation, that we are becoming more. We hope to have our AGM in January. We will soon give a notice. As you join membership, at least we'll keep you in the communication channel.